6 pregnancy conditions that can be a false alarm. Pregnancy may be a natural physiological process for some. However, for most women, their first pregnancy is a period of anxiety and uncertainty due to whirlwind of symptoms they experience. Unsure of whether these new feelings are just part and parcel of the pregnancy or a false alarm, many couples stress out over minor issues and pass on the stress to their family, friends, and even their physician. Obstetricians are often heard complaining of patients who call the doctor for the most trivial of matter as they are afraid they may overlook something serious. During subsequent pregnancies, women are mentally prepared and are better informed about the danger signs, but in the first pregnancy, everything feels suspicious and alarming. Here are a few false alarms of pregnancy that cause more anxiety than needed. Number 1. Mild vaginal bleeding. Scary as it may feel, not all bleeding episodes end in miscarriage. Mild bleeding or spotting is often experienced during the first trimester of pregnancy. It can also happen after exertion, lifting, or sexual intercourse. Although spotting can be ignored, heavier bleeding should be reported to the doctor immediately. Number 2. Fever. Pregnant women are often paranoid about getting a fever. Not only are they afraid of passing on their germs to their unborn baby, but many women refrain from taking any oral medication, which makes them feel worse and prolong the illness. The truth of matter is that even though drugs should be avoided in the pregnancy, anti-inflammatory and antihistamine medicines can be taken safely. Number 3. Headaches. It is fact that severe headaches in pregnancy may be due to pre-eclampsia-related hypertension, but in most cases a headache is just a headache. Controlling triggers such as fatigue and stress are usually enough to manage a headache effectively. Number 4. Contractions. False labor is clinically established diagnosis because uterine contractions do occur during the end of pregnancy, which can often be mistaken for labor. False labor can be differentiated from true labor as contractions in true labor get stronger as time goes on. They come regularly and get closer together over time. Another distinguishing factor is that false labor pains get better with movement or change in posture, whereas true labor pains remain the same. Number 5. Pain. Pain is always worrisome for the patient, especially towards the end of pregnancy, as it may indicate progression of labor. Pregnant women are advised to give attention to the nature of pain. If the discomfort is felt in the front, like menstrual cramps, it indicates false labor. On the other hand, if the pain or the pressure starts at the back and moves towards the front, it indicates true labor. Number 6. Fluid discharge. Water bursting is a sign of labor, but is it really water or something else? Passage of secretions, discharge, or even urine can be confused with water breaking. A well-informed patient knows that breaking of water feels like a constant trickle of fluid from the vagina or a sudden gush of fluid. Having a kid is a stressful time for both mother and father. Good obstetricians understand the state of psychological and physical stress. They take out time to educate the patient about the physiological changes to be expected during pregnancy, as well as the danger signs, which have to be clinically treated as soon as possible. If the mother is educated about all aspects, it will save her from a lot of unnecessary stress, help her enjoy her pregnancy, and treat it like the natural physiological process that it is. Hope you guys enjoyed this video. We'll meet in the next video.